is there a typical time somebody has a breast reduction procedure? And I'll answer that kind of from two perspectives. One, like certain time in the year, and then certain time in life. So, certain time of the year, I'm asking you not to swim. So, I think from a recovery standpoint, a lot of patients, when they're having bigger surgeries, prefer to have it in the fall, winter months. You're not outside, you're not trying to go swimming. It's just kind of easier to lay low and nest and just recover. So that tends to be more common. But I mean, if you're confident that you're going to not miss the pool for 6 weeks, and I'm totally comfortable with performing it during the summer, it's a great option for teachers and other people who might have off during the summer. And then in terms of a different time, a certain time of life. So there are two main sequela of a breast reduction that I have to counsel my patients on. And one is the biggest one is the propensity for breastfeeding. If you are somebody who has not had children yet, you potentially see that in your future. You might consider either breastfeeding or pumping. I'm removing glandular tissue. There's a theoretical risk that I will reduce your breastfeeding potential. I tell patients that usually after breast reduction surgery, about a third of patients can breastfeed no problem. A third of patients will have to supplement with formula, and a third of patients will not be able to breastfeed. But that actually mirrors the general population of people who have had breast reductions and who have not. So, how much the surgery affects that potential is really hard to say. But I think it's important for patients to understand that that is a possibility. And I wouldn't want them to regret having this surgery in the future and, always wondering if that was something they were super passionate about. I would say I like patients to be within their ideal weight, no huge plans for significant future weight loss or weight gain. And that's just for, a risk of like recurrence or your skin sagging or just like the balance between how much tissue you have and how much skin you have being thrown off. That is a risk that happens with pregnancy. So, anybody who hasn't had kids yet and they might have kids in the future, I tell them there's a chance you want a revision in the future. I don't know what your body's going to do after, your breasts are going to get larger with pregnancy. They will stay larger if you decide to express milk, and I cannot predict how your skin will retract back when that is all done. Those are the two main things for like when in life. They have to have that in mind. Usually they're so motivated that like they accept that risk and they're ready. But I will do it at any point for patients. Obviously, if you're under 18, you need a parental consent. But I also have treated women well into their middle age who have large breasts and they're just tired of it.